This question states, what is the primary purpose of obtaining a patient's last menstrual period during intake? So let's take a look at the choices. So option A says to assess the patient's overall menstrual regularity. So you might look at this and think right away, oh, this seems like a great choice because we're looking at an overall picture for the patient and we're taking their intake. This sounds like a good choice. However, something to consider here is that we are just asking about the very last menstrual period. So not their whole history of how regular they are, how heavy their periods are, just the very last one. And this choice is stating overall regularity. But really, the last date alone wouldn't really be giving us all that much information. So we could consider option A, but there's likely a better choice here. So we'll eliminate it for now, but maybe we'll come back to it. Option B states to calculate the patient's expected ovulation date. And now with this choice, calculating expected ovulation date, this is something that can be useful when looking at a patient's schedule with their period to kind of get an idea of when they can be ovulating, when they can expect it next, when they can be most fertile. And this is good, helpful information. However, the question is asking about the primary purpose. So there might be another answer that's a little more important for what the healthcare provider is looking for at this moment. So we will eliminate option B for now, but again, maybe we'll come back to it depending on what we see in later choices. Now looking at option C, it states to screen for potential pregnancy, especially in women of childbearing age. And yes, this is very important for the provider to know if we're concerned it's been a while since the patient last had their menstrual cycle. Maybe they're pregnant right now. This could affect the care and what we're looking for. And if they're not pregnant, maybe there's other factors involved in their overall health that are involved with not having their period at a certain time. And so that would also be important for the provider to know. So this all seems like good information to obtain. So for now, we will go with option C, but let's take a look at option D as well, just to be sure. And option D says to determine the appropriate dosing for certain medications. And typically the last time they had their menstrual cycle, or LMP, would not affect their dosing of certain medications. It would be a better choice to go with option C, screening for potential pregnancy for women of childbearing age. That would be more appropriate than option D. And looking back to options A and B, which we eliminated as well, option C seems to be more appropriate for what would be most relevant to the provider at this time.